Hey guys, my name is Fabian, and our group would like to discuss with you what Down syndrome is and how it affects the stages of motor development. Down syndrome is the most common chromosomal condition. This condition is also called trisomy 21 because the baby is conceived with the full or partial extra copy of chromosome 21. About 6,000 babies with Down syndrome are born in the US each year. Down syndrome can occur at any maternal age, but the possibility increases as a woman gets older. Down syndrome occurs before conception. Nothing you do during the pregnancy will increase your risk or reverse what has already happened. A 25-year-old woman has a 1 in 1,200 chance of having a baby with Down syndrome. By the age of 35, the risk has increased 1 in 350. By 40, it is 1 in 100, and by 49, it's 1 in every 10 babies, according to the National Down Syndrome Society. Although researchers have pinpointed how Down syndrome occurs, they still don't know very much about why it happens. This can make it difficult to understand whether you're at risk of having a baby with Down syndrome. There are certain characteristics that a child with DS possesses that are distinctive to this disorder. The baby is typically born premature, which leads to low birth weight. As the child gets older, the growth rate is slowed and they are shorter in size. Facial physical features include small nose, chin, ears, and teeth, and are usually not yet mature. Other physical differences include poor balance, shorter arms, and legs. The legs are also not as elastic. Health-related issues include cardiovascular limitations and respiratory illness, which leads to a restriction of cognitive function. Language and forming ideas is also limited. As for motor development, it is a slower process in children with Down syndrome.
Because children with Down syndrome gain skills at a much slower rate, they tend to gradually fall further and further behind than those without Down syndrome in the same age group. They have conditions like hypotonia, which causes decreased muscle tone and strength, which results in floppiness, and hyperreflexia, which is overreactive reflexes, which can increase chances of injury. Early identification and intervention programs appear to be successful in improving the motor functioning of infants and young children with Down syndrome. Activities to improve reflexive behavior and to facilitate the acquisition of rudimentary movement skills should be provided during the crucial early years. In the article by the Medical Science Monitor, Dr. Roxana and colleagues discovered that functional balance should be considered in the therapy of children with Down syndrome because balance may influence development of motor abilities, especially those that are developed in childhood.
Children in a study with Down syndrome explore the objects less often compared to typically developed children. According to a study by Research in Developmental Disabilities, the infants with Down syndrome showed a developmental trend that was similar to typically developed infants, increasing the frequency of reaching after reaching onset. This finding suggests that the infants with Down syndrome practice the task of reaching for objects in their daily interactions and are able to learn from them in the same time interval than typically developed infants. Infants with Down syndrome also performed less complex motor skills compared to other children. Children with Down syndrome were more attracted to softer and rigid objects, and typically developed children preferred only soft objects.
Now hopefully you guys learned a little bit more about what Down syndrome is and how it affects the motor development in an infant. Also, hopefully you guys learned some new different techniques to help improve their motor skills. Thanks for watching.